I want you to imagine being in a hospital, laying down in bed, alone, not able to move your body, your arms, your legs, your feet, because of the pain you're in. You're feeling stressed and weak, and your body is unable to fight this illness that you are in. This is a true situation that a lot of patients with terminal illness have to go through every single day. According to Dr. Jim Collins, physician-assisted suicide is a procedure where the physician provides the necessary information to facilitate the patient's choice to end his or her life. It can also be known as other two names, for example, doctor prescribed death and physician assisted death. Physicians, some people argue that it is like euthanasia, but the purpose of physician assisted death is to assist, like the name says, not to intentionally end the patient's life. Doctor prescribed that should be available to anyone that requests it because it respects the patient's individual's autonomy, it relieves them from the suffering they are in, and it is also a safe medical practice under the supervision of a medical doctor, under a professional health care. According to the 2020 Department of Public Health annual report, 2,858 people received a prescription and 1,860 individuals died right away after they ingested this prescription. This is data from the state of California. If it wouldn't have been for the physician-assisted death, these 2,858 people could have been suffering from their illness up until this day. Patients' individual autonomy is crucial when making a medical decision. That is why when a medical procedure is needed, the doctor consult the patient with this problem and then provides him with a variety of solutions to resolve the illness or to treat the disease. There's no difference with the physician-assisted death. It's the same procedure. The doctor goes to the patient and it is provided with the medical information and the risk, and after that the patients have to decide whether to do the procedure or not based on the information the patient was given by the doctor. Freeing the patients from suffering is the #1 priority of the doctors. The National Library of Medicine explains that medicine has been aimed to relieve the suffering of patients from their illness and disease. Therefore, if deciding to not be in this war anymore by the patient's own decision, then I don't see why the outside world, the surrounding people, have to interfere with the patient's desire. Lastly, a safe medical practice is overall the best option compared to committing individual suicide, which means committing suicide by your own. Being supervised by medical professionals allows the procedure to be in more control and to be in a calm environment. That is why physicians have to follow rigorous rules in order to make the patient more comfortable of these last few days that the patients have. AMA Code of Medical Ethics states that physicians should respond to the needs of the patient's need. They should not abandon them. They should respect and must respect their patients' autonomy and provide them with good communication, with emotional support, and adequate pain control. Living with terminal illness is not easy for anyone, neither for the patient and neither for the family. That is why the best way to comprehend the patient with terminal disease is by listening and by understanding their point of view.